Okay, so we have Todd Simpson and Beth Killoran. Todd is the CIO of FDA, and Beth is the CIO of HHS. So I want to really dive into it quickly. So over the past few years, we've seen some evolving citizen needs, advancements in technology, new legislation has changed how the federal government implements health IT. And agencies have heavily invested in health IT adoption and digital information with an eye towards innovation and emerging technologies. I'd like you to kind of set the stage and describe briefly how your role is helping that happen. So Todd?
We'll let Todd go first,
Yeah.
because he's on the front line.
Well, I guess the simple answer is my role is to enable the business at the FDA, and it's a tricky business. But that's why I'm there, and everything that I do is intended to keep those missions in the centers moving forward. So we have a strategic plan, and we walk that path very diligently. We've executed about 50% on the plan since its inception in October of 2015. And we reevaluated the plan and updated it to account for changing mandates with the new administration and just all the new technologies that were available. And I think that the trick is really making sure that you listen to your customers and you have active engagement and you're aligning your technology and your business processes. And that's how I do it.
And you and I talked a little bit prior, and you said, we are keeping the lights on, we are working on cybersecurity, and it sounds like you're kind of doing the behind the scenes, not so sexy work when it comes to
So at the
IT.
departmental level, so the operating divisions within Health and Human Services are really kind of doing the great new innovative technology, because they're on the front line and they have the problems to solve. But I always consider myself as the road work behind the scenes, because if you don't have the right infrastructure, you don't have the right byways and intersections, it doesn't matter what kind of great tech you have out there, it's going to be very siloed and be ineffective. One of our organizations this year, as we were working on 1722, talked about that the department is data rich and information poor. That means that we've got tons of data, but it's not integrated, and there's no way to be able to really solve and work on particular health crises or particular human services areas because it's so siloed. Some of the reasons for that are the aging legacy infrastructure and the legacy systems that we have. So my job is to bring us up to par with industry so that we can then do plug and play with the operating divisions to do that great new tech.
And Todd, you and I talked about this before, that your agency or FDA has really implemented cloud to a large part. So FDA was the first agency to use a cloud brokerage model to drive standards. Can you talk a little bit about that?
Okay, sure. So we built a trusted cloud platform. It's our cloud brokerage model. I'm very proud of it. I've talked about it at different venues, but it continues to mature. And we're at a point now where we're actually doing this cloud roadshow. We're going across the FDA, making sure that we get exposure to all of our customers. Again, it's a federated environment, so sometimes our customers will look to us for the shared services, and we just need to make sure that they're aware of what those shared services really are, and that's really the intent of that cloud roadshow. But basically, we showcase our cloud portal, the tools that we've built to make it easy to navigate the cloud. We have a decision tree, a calculator that allows our customers to estimate what they're going to be charged to spin up an environment. And in that cloud brokerage model, we have now 6 different cloud service providers providing infrastructure, software, and platform as a service. So we've covered all our bases, and again, we continue to mature it, and we're just trying to make sure that we fill in all the gaps in the model and make it as user-friendly as possible. And of course, that doesn't say that there's an end to on-premise, because that one of the tools is that decision tree, which allows our customers to say, well, what is the best combination of resources that I should put together to make this happen? What's the safest way to proceed, or the quickest way to proceed, or the most least cost path? So we're pretty proud of that. And I don't know if we're the only cloud brokerage model in the federal government, but I think that we're maturing at a very rapid rate. And I want to give that cloud brokerage model to Beth through some kind of an IIA so it can be leveraged and the other optives don't have to repeat the work that we've done.
So while Todd's doing kind of a cloud brokerage internally, NIH is actually doing a cloud brokerage with educational organizations, because obviously within NIH they have a great deal of research data. But this is becoming very large, very complex. No longer can any institute or university store all of the information, and trying to move it even across their very fast research network, internet too, is becoming difficult. So they've actually been working on a brokerage model with some of the big cloud providers that we can actually authorize vouchers to universities to get in moving their data to the same cloud through a brokerage model. So we're working on both internal and external cloud brokerage within the Department of Health.
And you mentioned to me that one of the biggest challenges within your department is legacy systems. So how are you approaching those?
So we're looking at the totality of our legacy systems, and so we first had to look at something that's called high-value assets. It's a pretty common term now within the federal sector, which these are the programs that are most critical to running the government and running agencies. So things that have direct interface with citizens or direct capability to making sure that there's a continuity of operations across the federal government. Internally to HHS, we have a little under 100 systems, of which, of those high-value assets, 57 we've determined are the most critical. So we're working on replacing those or modernizing those systems first. My organization has made sure that we've done analysis. We've let all of the operating divisions know where those particular systems are and what technology is past end of life, which means it's no longer supported by the vendor. For me, it's not, is it a operating system, because you can keep patching it, you can keep making sure that the updates are there. These are truly systems that are past that. That means that the vendor no longer supports it, or you're going to pay a substantial amount of money extra in order to get the support. And now we're also working on, so we're having the operating divisions do those plans, and then in addition, there's 2 or 3 technologies, you can probably understand what those are. So we're actually working directly with the vendors that are providing those. So for example, I heard one of them was giving FDA a plan. I said, no, we can't do it at an FDA and an NIH and a CDC. I want the HHS plan. So you tell me how you're going to fix the department and all of these systems, not just one organization. And so we're trying to work on it at a 2-factor, one at the organizational level and one at the vendor level.
Mm-hmm. So I want to go back to you talked about cloud, which is pretty much mainstream technology these days. I know you mentioned AI and you've mentioned machine learning. What are some of the work you're doing with those technologies there?
Well, if I could just mention about the legacy systems. So I talk about the execution of the strategic plan, and I talk about what we've invested in our cloud infrastructure. And it really all comes back to the legacy systems and this interoperability first mantra that I'm adopting at FDA. Because interoperability, system duplication, and data are 3 biggest challenges at the FDA. That's I've said it for the 30 months that I've held this position. And so it's trying to solve that interoperability nightmare, if you will. It goes out, it goes in, it's not just internal to FDA. We have to talk to other agencies. But just that interoperability when you're dealing with legacy systems like that. We're investing in the cloud, not only so we can move toward this DevOps pipeline where we have microservices and agile development, but all of that cloud work is just foundational. And I think what we really need to do is kind of bring a little bit more order to the way we do our development, the way that we manage our business, and really leverage the cloud and build a pathway to migrate our legacy systems and to do new development. And I think it can all be done. I know it can all be done in one model, but that's kind of where we're bringing everything together. Now, to answer your question about AI and the innovation side of the house, we have an innovation lab, and as part of my, I would say my workforce optimization initiative that I've just kicked off, it's an official project. I'm realigning everything in my organization. And I previously had innovation separated from my CTO's shop, and I did that for a reason, because I dedicated my CTO to doing some infrastructure stabilization. At the right personality at the right time, everything lined up. But we're a little bit beyond that now at the FDA, and so I want to bring the innovation back into the CTO shop and focus on the innovation piece and the EA piece, and really flesh out the governance model a little bit. And inside the innovation realm, we've brought lots of different technologies. It's hard to talk about the technologies in an agnostic manner, but there are several technologies that we're looking at that are complementing one another, and we're finding the use cases across the FDA. And I've actually taken a kind of a different approach. In previous roles, I was slow to put vendors right in front of my customers, because it was like this opportunity where the vendor could sell. And the customer may say, wow, this is great. I want the leather interior and I want all the bells and whistles. And I'm not there to shepherd it. But the role is too big at the FDA. There are 22,000 users. It's federated. So I have to rely on my vendor partners to come in. So I look for strategic partnerships. Ones that I can really trust, those contractors that aren't going to lift up the rug and sweep the dirt under it and drop the rug when I'm not looking. And it's really, really important. That's kind of a message to everybody, because I need more of that strategic partnership, especially in the innovation front when it comes to things like AI, to get in front of these scientists that are much smarter than me, that are trying to solve problems that I can't even get my small brain around. But I can get people in front of them that can actually come up with a solution, and then we can dilute it and we can run it through the paces of the innovation lab and put it into a proof of concept and a project and full implementation. Very long answer, but I'm trying to send a lot of information out to this community that maybe they can use to penetrate the hard shell of the FDA if they want to do business. So.
I want to go back to what you said about Agile and DevOps. I mean, it's a big shift from the traditional waterfall approach. So how was that to kind of go through the process and embrace a more Agile approach?
Most of it is culture. And, it's really, we talk about waterfall, we talk about Agile, and I don't want to oversimplify it, but it really comes back to just being a good steward of the business and understanding what you have, knowing what systems are out there, taking that catalog, and then making sure that everything's ATO'd, making sure that the knowledge is transferred through some kind of idle knowledge transfer process to a help desk, that resources are being properly hosted in secure environments. At the end of the day, I think it's really a simple thing to manage the business like you care about the business, and not to be in this reactive mode. And I'm kind of talking about the federal workforce a little bit. These are challenges. I've heard this saying, culture eats strategy for breakfast. And I live that every day at the FDA, because we have a strategy, but the culture is always ever present. It's like working against, this is the way that we do it here at this agency, and I've heard that every agency I've went to. We're not like the private sector. We can't run government like a business. You can actually get closer to that. It's just bringing in good stewardship, I think. So that being said, once you have that, okay, so maybe there's a couple different ways to look at how you do your development. It's very common in the federal government for teams to be built around systems. And that's something I think that perpetuates that legacy application model, that, where you have those monolithic applications that are around for 20, 30 years, because you're building a team and you're hiring a bunch of feds that are going to be here possibly for 30 years. So they have no vested interest to change the technology, because then they would have to change, and that's not human nature. So you just have to accept kind of what we are and say, well, maybe there's a better way to do it, and maybe we can just move away from that team approach where everyone's dedicated to a system, and every time I build a new system, I have to build a new team. And maybe we build a pipeline, and we build environments where we have a production environment, a test environment, a dev environment, kind of like we did when we worked in the private sector. It's not it's not rocket science, and this stuff has been around for 20, 30 years. As long as I've been in IT, and much smarter people than me showed me how to do this stuff. So I don't know any other real way to approach it other than to build that pipeline to leverage your matrix organization and use ITIL. Find a framework that you can apply. And if you find a framework, it's all about identifying roles and defining those lines of accountability. And your model has to have accountability. Without it, you can't execute.
And Beth, you're nodding. What is it that resonates with you?
Well, I mean, so I think FDA is actually a little bit of a lagger for Agile in our department. It's the one area that our department actually is achieving FITARA, so we actually have a B in Agile development because we have making sure that we're doing things and really appreciating Todd's support and getting FDA to that same level. But I think one of the things that we have to do as a federal organization, which is, what is the things that we want to keep internal? And being able to understand the one area of business, I think, is what is our core business and what do we need to release because it's not our core business. And historically, the government has wanted to have everything be their core business. And when you're a jack of all trades, you can't be a specialist in any one of them. So we have to look at what can we do, how can we leverage cloud, how can we leverage other technology so that we can actually put those smart people back into the mission programs that are delivering capabilities that only the federal government can provide, as opposed to trying to spread our tiny little bit of dollars, in some cases, to try to do everything. Because I think that's where we're struggling. And then, when we keep building things and we have to keep carrying feet of all of them, and we all want to protect the thing that we built, there's no way to then try to bring all of those capabilities together because someone feels that they have either done something wrong or that their program is no longer viable or needed in an organization, when I think that we have to promote both from a budgetary perspective, which I think is another piece, because all the money goes into an individual program. It doesn't go to certain kinds of capabilities. If we can be able to promote and respect and actually make sure that we're championing where those things come down. One of the areas, for example, as I mentioned, is data. Well, if every single system has its own data with its own lexicon and its own way of managing that data, how do you ever bring data together to solve real-world problems? I mean, if we are going to try to, cure cancer or bring drugs to market quicker or fight the opioid crisis, right now we have opioid data in 5 different octaves in our organization. So, I mean, we're going to try to, our chief technology officer in a month or so is actually going to do a codathon to try to bring that data together. But if each organization says, no, it's mine, how do we solve a crisis as a group versus individuals? As we were doing our 1722 work, one of the things I think we all recognized, and I kind of talked about, which is many federal agencies do great jobs in crisis, right? So we're fighting, 3 hurricanes, and wildfires. We all come together during those times. We do a phenomenal job because that's where we come together. We take down all the silos. We just know that there's a problem in solving it. But as soon as those crises are gone, everybody goes right back into their lane and doesn't want to talk to anybody. So how do we flip the norm that says crisis mode, not wanting to have a crisis, but how we operate in crisis becomes the norm versus the other?
And both of you mentioned cybersecurity as a challenge and a focus area. Todd, you told me that we have a cybersecurity story to tell. Talk about that.
Oh, yeah, we have a great cybersecurity story to tell at the FDA because we had to go through a GAO audit at the hand of the Energy and Commerce Committee, and it was actually in play when I arrived in May of 2015. So we went through the audit, and they found a bunch of stuff, and it resulted in a report that had a kind of a scary title. It was a little misrepresentative, in my opinion.
What was the title?
Industry data is at risk, something like that. And there had been no breaches to qualify that. There had never been any compromised data. So our systems, though, did have some audit findings, and 15 programmatic recommendations were made, and we actually resolved those programmatic recommendations in record time, and those are the words of the Energy and Commerce, or the Energy and Commerce Committee folks themselves, that we we did in 45 days what other agencies took 18 months to do. So we were very proud of that. And Beth was talking about high-valued assets before. We have 16 HVAs, and we put together a program as a result of one of the programmatic recommendations of the GAO audit to manage our high-value assets. And it was just recently picked up by OMB and the White House as a best practice for the federal government. So the work that we're doing in that cyber program is being recognized. We stood up a systems management center, which was a combined NOC and SOC, and we won a CISO 2017 award for that work. But more importantly, the results are really in the operations. I think we've reduced our mean time of outages by over 60%. Our response rate is just, it's incredible because the work actually starts before the ticket's even opened. And the ticket gets opened and everything gets logged, but there's this actionable approach. And so our cybersecurity story continues to be told because we're now, of course, implementing CDM and all those technologies that comprise CDM. And we're pushing, I think, the bounds of CDM because of our cloud brokerage model in that, I think when CDM was first kind of thought up, there was a cloud-first initiative, but I don't think the two were really aligned as closely as they needed to be. And I don't think it was anyone's fault as much as it was just available technology. You don't know what you don't know. But now we know we have to watch the data that's moving between the cloud and the on-premise facilities. And CDM, there are technologies that have come on the market since. So we're now looking at implementing those technologies and moving forward. And I hope to serve as an example for other agencies that start to get to that state. So just back on the comment, we are experts at reacting in the federal government. And that was kind of the culture eating strategy point. Beth really made it much more eloquently than I did. We're always reacting, and we're really good at it. But if we could, and I hate to use the trendy word of being proactive, but getting ahead of that stuff through just understanding the business and building the funnels that any problem can go in, and thinking out what those problems are, and doing better continuity planning, succession planning, and all the things that go into managing a business from a more holistic standpoint, instead of just being good in emergencies, which we are. We're amazing in emergencies. So,
Beth, do you want to talk a little bit about cyber?
Yeah, so I'm going to start with a question. So I'm going to do a poll for the people here in this room. So by a show of hands, how many people in this room either currently have or know someone that either has Medicare, Medicaid, CHIP, or the Affordable Care Act insurance? Raise hands. That's about 3/4 of this room. We have your data. We have your data. If that doesn't say that we need to make cybersecurity our #1 priority, I don't know what it is. And as the culture of the breach organizations, the people that want that data, is shifting from credit cards and social security numbers to whether you have a pacemaker, whether you have some sort of maybe mental health that you don't want to have out, that makes it that much more important for us to protect your data, because your data is about you. It is not for someone next to you to know unless you personally want to share it. It should not be used against you, and it should not be in the hands of people that would want to do something with that. And because of that shift, our #1 thing is to protect the American citizens and their data. Just by the show of hands in here, we actually know that we have at least 1 in 3 Americans' personal identifiable information. And that's in addition to the fact that we have your health data. You put those two pieces of information together, we probably know more about everybody around the country than most organizations have, which make us a primary target. And then you add on top of that, we have information about drugs that might be coming to market, or medical devices that are coming to market, or research that's being done at NIH. That makes it an even larger target. I love that FDA has the statistic that they have over 500 million breach attempts a week. And that's just one operating division. You can imagine how many we have to fend off on a given week. And so if you look at that and then you look at how much we're spending on cyber, it's just monumental what our staff is being able to do. So on average, they want you to spend about 6 to 8% on cyber of your total IT budget. We're spending about 3 or 4. And with that, being able to do incredible things and being able to fight off these very sophisticated hack and breach attempts without having compromise of data. And that's in addition to making sure that we are doing the things that we need to do around CDM and Einstein. We get what we need to do from a federal perspective, but what I think we need to think about in cyber is not here's a mandate we need to make to it, or here's an audit and we need to close that in a reactive mode. We need to get into a risk management model. So we really have in the department looked at what we have as our threats, what is our risk, and it's actually very enlightening to me if we actually had our business come in and do an enterprise risk. It wasn't the technologist, it wasn't the HR directors, the business came in. And I bet you can, if I told you the top 3 risks in our department, you wouldn't be at all surprised. Number 1 is cyber, number 2 is human capital, and number 3 is legacy systems. That is what the business determined. And so if number 1 is cyber, we better make sure that we're working on it because we understand that those high value assets can be taken down by being an old system or by being breached. And in many cases, they go hand in hand. And so we have to make sure that we're building in capabilities of protection. It's not mission or protection, it's mission with protection. Because if you don't, it won't be there. Industry has had this type of concept for a long time, but it's usually called quality control or quality assurance, right? You need to make sure that your products don't have defects. Well, think of a ability to hack into it. A vulnerability is a quality assurance problem. Mm-hmm. And so how do we make sure in both industry and in the public sector that we don't have any of those quality assurance problems?
And one of the questions I asked you, Todd, prior to this event was, how has your role as CIO evolved over the years? And you said, there was no chief data officer a few years back, there was no innovation lab. Mm-hmm. What else have you encountered that didn't exist a few years back that you have now?
Those were the big ones. I mean, data was not like this focus area when I started. It was really, IT was just really easy, but I started as an engineer too, studying for Microsoft certifications and CCNAs and things like that. It was all about technology. So maybe the data was always there and we just didn't know it, I don't know. But definitely this emphasis on, data standards, this kind of acknowledgement of the necessity to have a framework, that you rely on. I think you can bring experience and know-how to any problem, but you should always try to find a framework like we did, EIDL or NIST, in the President's executive order that he just released in March. He asked all the federal agencies to comply with NIST, and we at HHS were kind of ahead of that. We have a NIST framework, and we're mapping our technologies to align with that. So I don't know if it's net new areas like governance and data, or if it's just refining or getting deeper. And I don't know if it's always been there, or if it's just because I'm learning more. But man, so many follow-ups from the stuff that Beth had to say. I just want to chime in. At the FDA alone, one of the findings was that we weren't spending enough money on cyber, so we went from 3% to 8%. Meanwhile, we've decreased our budget by about 9.5% since I've been there, and I've watched the user population at FDA grow by about 20%. And meanwhile, we've executed the 55% on that strategic plan. And all of that is just really because of a different mindset. Because instead of just waiting for something to smack you in the face, going out and kind of just elaborating on the thoughts that Beth has kind of sparked for me, getting out there, understanding what you have, caring for it like you would if it meant something to you. And just, having holistic management of it, and saying, what if something happens, or what can I do to make this better? And and I think that some of that is taking place even with our legacy applications. And we just had this, the deeming, the vape shops all registered through our federal through our listing application. It's a legacy application. It's a very old application, but we enabled that through care and maintenance, through heavy investments in O&M, and development to make it bigger, better, and usable, even though it's kind of outdated. So I didn't mean to take us back in the questions.
No,
it's just
fine.
she said so many interesting things I could probably talk for an hour about.
Okay, we're going to take a couple of questions. So, one question before Mike yells at me.
Sorry.
He has a mic here.
Does anyone have any questions for CIOs?
Where are the reporters?
Yeah, this is
Tom Suter.
Suter. I have a question for Todd. A little bit more detail about, managing these legacy systems, putting things in the clouds. Do you have like an API gateway? How do you have that in place yet, or? Because another agency was just asking me about this the other day.
Yeah, so
I was going to say, now you've hit the thing that's my big hit for 2018.
so why don't you? Yeah.
So my big hit for 2018 is a microservices departmental gateway legacy new version of a service bus for all of our management systems. It's my hit for this year.
Internal to FDA, obviously the APIs are a big deal to get the interoperability, that I identified as one of our 3 major challenges. So we've actually identified a cloud service provider that we're looking at partnering with to provide that support. And we've got a few other ideas, but there's a whole roadmap for that in our microservices.
Right, so we're going to kind of leverage some of the capability that FDA has done around microservices, and then I already have commitments from at least 2 of the 3 line of business in the management suite to do that across the department. So that'll be a big, huge thing, because right now, for example, some of our systems have over 100 different interfaces alone, and then if you do that on a multiple system-to-system basis, point-to-point, you can imagine the complexity and costs associated.
Okay, I think that's all we had time for. Thank you, Todd, and thank you, Beth.
Yep.